Aloha and welcome to Ka Pewa. I'm Kanoa Leahey, and today we're going to look into the topic of rethinking our healthcare delivery system through housing, access improvements, and job training. So we're going to get a little technical here on what is the delivery system for healthcare, specifically on the island of Maui. And to help me talk about it, we welcome the president and CEO of Ohana Pacific, Wes Lo. How you doing, Wes?
Good. Aloha, Kanoa.
Thank you for being here. First off, Ohana Pacific, can you give us a little bit of an overview of this organization?
Yeah, so Ohana Pacific specializes in what we call the post-acute care setting. So after you get out of a hospital, and we're dabbling in health as opposed to sickness. So trying to keep people well and at home. We are the largest provider of what we call post-acute care services in the state of Hawaii, and it includes Hale Makua on Maui, which is the pretty much the main rehab and nursing facility. So we got nursing facilities on all 4 islands, and we have home health, and we have something called our care transitions business.
All right. Well, we focus on the island of Maui, and you have, frankly, been involved in healthcare on the island of Maui specifically for a long time. You have seen perhaps a little bit of an evolution in the healthcare landscape. How has it changed on Maui, in your opinion?
Wow. Healthcare has been moving at light speed over the last, I guess it's almost 20 years, Kanoa, since I was at the hospital, et cetera. So a lot of things have happened. Number one is I think the population has changed quite a bit. The dynamics have. I mean, obviously that famous term, the silver tsunami, is happening. And over the years, one of the things that's happening is people are getting older, so they're sicker. But technology and healthcare has advanced quite a bit. So there are ways that you can have healthcare to actually keep people out of hospitals and out of institutions. And so that's changing. But a lot of the things are we're still delivering care in an old system. Some of the other things that have happened is although Maui is naturally aging fast with the demographics, we're seeing out-migration of 25 to 64. So all the labor is going. So we're all of a sudden suffering these challenges. And I think, frankly, over the last 5 to 10 years, there's been a lot of attention on how do we keep people well as opposed to treat them when they're sick. And so it's something called social determinants of health. And the whole the mindset and the jargon is about how do we keep people out of the institutions and healthy.
Yeah, so you're basically talking about this surge in people of an elderly age in our community. These are the baby boomers who are now getting to certain ages, that silver tsunami that you're talking about. And so at that time of a person's life, there is perhaps more need for medical deliverables and healthcare services. But by the out-migration that you are referencing on the island of Maui, where you have a lot of people involved with the labor force moving elsewhere, where do the resources come from? And so with that population aging, with the workforce seeking opportunities outside of Hawaii, what is the first step? How do we ensure that residents will still have general access to safe, affordable, high-quality care here at home and on the island of Maui?
Well, boy, that's a complex
big question.
Yeah,
it's
a big question. And I think it's not only healthcare. Certainly, there's a lot of factors. I brought up the term social determinants of health. I'm sorry, my geekiness about it, but social determinants of health is not always things that we think of as healthcare. What do they say? One of the most common plagues of aging is loneliness. It's not your health. It's the loneliness and the companionship. And so to some extent, it becomes a community issue. And I think that as we approach trying to figure out a better way to deliver healthcare or well care, I call it, is trying to create a better community. It's community development for the loss of the jobs, et cetera, and the people, the workforce. You need to start building an integrated system where you have the cost of living is addressed, et cetera. But you also need to start thinking about education. You need to start having people rise up, and they can help take care of a community. I think we've done some studies, and really, how can somebody take care of someone if they don't take care of themselves? And that's the same for a community. So I think that as we move forward, especially on Maui with the fires, COVID, et cetera, we got to start thinking about how we improve our community. And I think with that, we can start putting the structures around to improve our healthcare system.
Because from a cultural standpoint, I would imagine that the infrastructure is there, right? Just the desire for younger generations to care for the elderly of their community, our kupuna, right? That is there. It's just a matter of tapping into that and making it a little bit more justifiable for these individuals to want to stay here and work.
Well, want to stay here and work and also thrive. I mean, you imagine, you've seen it on Maui. There's a lot of people that are extremely talented, just don't have the economic ability to continue to go to education, et cetera. And they take the first job they can get out of high school. And then they're working 2 or 3 jobs, and they got to take care of their family. Why does that make sense? Why don't we try to figure out how we make the kids, give them the job, give them the education, right? Rising tide floats all boats. So then they have the ability to take care of everything, and they can stay here. I think everybody wants to stay in Hawaii and on Maui. It's just that they can't afford to anymore. And I think we got to fix that problem. And with that, I think healthcare can be the lens in which we do community development, because it's a building block of society. Education and healthcare are the building blocks of society. I mean, if you're going to rebuild an economy, why not those 2 things, right?
Yeah.
And so try to float all boats through that.
Well, I've known you for a long time, and you've been talking about this for a long time, sort of the reimagining, if you will, about the healthcare delivery system. And you have an upcoming project that is very comprehensive as far as its vision. It ties together workforce development, housing, healthcare. So those are the pillars. If you would indulge me here, let's go one by one. Okay. Workforce development and jobs. How does this project, and if you could kind of explain a little bit of an overview of the project, how does it go to support job creation and career growth, as you're alluding to in the healthcare sector?
So we've started something, and it's still in its early stages. But in post-acute care, we hire entry-level people to start taking care of a lot of our kupuna, and that's not necessarily a great living. And meanwhile, we were trying to recruit people, but they were getting 5 cents more at the fast food chain or at the the retail place. We all know them, and they kept on, and it became a wage war. We're saying that there needs to be something more for them. They were just chasing the dollar. And so we said, well, what else would attract people? And we thought it would be a career. And so we started trying to figure out how we could bring in entry-level people, give them an opportunity, but also give them an opportunity to train and move up to the next level. So we've started, and we had this great need for what we call licensed practical nurses. So we started a program where we hire people out of high school or people entry-level jobs as a CNA, certified nurse aide. And if they qualified for it, we begged and begged and begged. And Uncle Louis at UH Maui College, he started this program. I can't thank him enough. But we actually started a program where we were able to train them CNA over a year, and we ended up creating so they could get paid. We would work part-time, go to school part-time. At the end of a year, they would double their salary and become a licensed practical nurse. So it started filling a need, and then we figured, well, can we get more people filling the pipeline below that so that people want to come and grow? And I think that it's been successful, but now we got to keep on growing it, and we got to keep on building other professions. And these people now have a future. They're making more wages than if they stayed in like the fast food industry or working several jobs in various other industries. So the idea is this can be the community that can support our people, and we can keep more people here because people aren't coming here. We just need to find the people that are here and want to continue to move up. So workforce has been super important to us. We've been supported by Hawaii Community Foundation, Weinberg, Castle Foundation. And it's become actually really quite a project for us, and it's actually the centerpiece for the healthcare growth and the pathway. We call it an earn and learn pathway.
Yeah, that's just one piece of this project, right? I mean, you talk about general healthcare. The specifics surrounding the project. What is the envisioned goal as far as how it improves Maui County's access to care?
Well, number one is I think that we needed more workers to take care of the more of our kupuna that are need help. So number one, it is just using our workforce more effectively and training them higher. So it gives us better access. But we also are trying to train these people to come into a new world where we're trying to keep people out of the institutions. You know, we're trying to train them how to deal with people at home and, you know, how to transition back to home because, frankly, you know, we always talk about when I was at the hospital, oh, we got to get more beds and everything. I'm going, wait, isn't the goal not to go to the hospital? The goal is to stay healthy and at home. So if we can create a community that has people that are used to dealing with kupuna, used to dealing with some, you know, deficits from health, I think it floats all boats, you know, for the community. But I would say that the problem with workforce development is in our economy and community, you can't just do workforce development unless you start also taking care of the cost of living in Maui. And so that I think has been some of the challenges, not only for our kupuna, but for our workforce too.
Yeah, and that's another component here, is the Workforce Housing Initiative. Talk a little about what was behind that and what is the connection here, affordable housing and the workforce within healthcare. So,
you know, again, I think our problems are so great now with the cost of living here and healthcare. And to redesign a delivery system, you can't do parts of it. You have to take on the whole project, which is fairly daunting. So we've been talking about redesigning the delivery system, and workforce was a key part of it. The other part was trying to build some new structures, physical structures, as well as the delivery system where we're out in the community and people can get in and get home faster. Again, my whole deal is you do better at home. You eat better, sleep better. You know, I mean, anybody's been in a hospital or nursing home, you want to go home. And it's a place to be, and we truly believe that. So the problem is you start educating people, and they don't have any place to work and live. So you do workforce development without having affordable housing, you're kind of stuck. So we were presenting to the Maui Economic Recovery Commission, and we started talking about it and saying we need workforce housing, and we need to figure out how to do it. And all the developers are talking about, I'm going to do it here, and we can build a single family home for this. And we decided to take a pause. And I went and approached a developer who does affordable rental housing, one of the largest developers of affordable rental housing in the state. And I said, how much money would you need to develop housing for entry-level people to rent? And I wanted it to, and then we figured it was 30%. That's sort of the number. 30% of their income could be used for rent. And if they were in a training program and they got to the next level, let's say they doubled their salary, could they move up in that same rental housing project to a nicer facility? So he actually went and said, let's do roommate units, 2-bedroom, 2-bath. It could be friends, it could be family or whatever. Entry-level people pay 30% of their income. They enter into one of these training programs. And we found that education, actually, another piece, I'm sorry, I can get more complicated, that on the education side, we have a shortage of teachers. And there's the same problem. They have educational assistants, entry-level people, but they now have a certification program to become a teacher. I go, well, why couldn't we make something where these people have the ability to get housing into the market, they earn and learn, and after a year and a half, they double their salary, and then they can move into their own unit. So we came up with that, and we were fortunate enough, Hawaii Community Foundation provided some seed money for that. And we are going to be moving forward on a housing project, 100 units, which can house up to 175 people, right next to our facility. And it's going to be a preference for healthcare workers and education workers.
And this is at Hale Makua.
Right next to Hale Makua, part of the Hāloa Community Center Park. So, and we're not just doing it for Hale Makua. It's any healthcare worker and anybody that wants to get an education. But our preference is to people that want to continue moving up, make our community better. And we're trying to, again, float all boats in this whole thing. I keep on using that term, but I think it's important that a healthy community can be better healthcare for our kupuna.
This project is obviously, as you can understand the way you're talking about it, extremely complex, expansive, comprehensive. But you also talked about the physical structures. Housing is one part of that. What else is part of this master plan? When it is hopefully completed, what are we talking about exactly here?
So, again, these things are kind of odd. It started off is that for those who know Hale Makua, we have 2 buildings. One was it's on probably 60 years old, and in Wailuku, I mean, everything, the infrastructure is falling apart. We really can't expand. So the idea was just to sort of consolidate our campuses. But as we started building that, we are designing a new 56-bed rehab to take care of higher acuity patients. So people, let's say, for example, somebody had a stroke, they go to the hospital for a few days. If we could take care of them at a less acuity type of facility and rehab them and get them home faster and also save the healthcare system money, that'd be great. So we're designing this 56-bed rehab to be higher acuity so you don't necessarily have to go to hospital. And we want to design it where it's about prehab and rehab. So you get prepared for these events and you do better. And the goal is to get you rehabbed and home as fast as possible. So as we started doing that and we started talking about the workforce housing, we've had a lot of interest from other healthcare providers to expand this rehab center. So now we are working with a large healthcare provider to actually perhaps put a surgery center on top of it and physician offices, and we are talking about other services there. And I think the idea is what they say in some of the other communities is you want healthcare to adopt the neighborhood, to make it be part of the neighborhood, to make it a wellness place, and to make it integrated, intergenerational, so that it's a really a healing environment.
Yeah, it becomes a healthcare hub in many ways.
To some extent, healthcare hub, but it's accessible, and where Hale Makua is. It's in Dream City, which was built in the
right there
in the 50s.
Yeah,
it's an aging community. We're surrounded by senior independent living, and if we can make this an intergenerational hub where it's about wellness and health and to combat loneliness, I think. It's great. And then the hospital can focus on the high acuity things. We can lower the cost of healthcare, and it's a clean, green industry. It's an economic development thing, I think, it's the highest paying wages by an industry, I think, in Maui is healthcare.
Getting back to the workforce and what you are talking about with regard to affordable housing, hopefully fighting against the out-migration of that would-be labor force. What about upward mobility? How does that become part of this experience because of the job training, because of their ability to be close to work, or because of their ability to be able to afford living here?
Yeah, so our thought was, is that the first part is we provide for the entry-level people. The guys making $22 an hour. We give them a place to live. We're also going to have 1-bedrooms. So that our hope is that once they get up to the next level, they'll want to move to it. And so all of a sudden you continue to have affordable housing. It's not set and whoever's in there stays in there. If they do, that's fine. But you have an opportunity to move into a 1-bedroom. So that's the thought. And then from there, I think that, we're hoping that, we're not making part of our project, but there's additional opportunity to start coming into the workforce, into the housing market above. But at least they're used to the housing market, and they have the rental and the ability to move up, etc. I think there needs to be more development on it. I think from the educational side, we are working with UH Maui College to now make one from licensed practical nurse to registered nurse. And so that they can go to the hospital and make higher wages, but we got to continue that on. So this is just the start, it's the start of it. Hopefully it's a big start. And, I think we've been really fortunate with the community and the county, Hawaii Community Foundation, the state have all been super supportive of this endeavor.
I think a lot of people who will be watching this podcast will also be curious, how could this potentially impact the cost of healthcare? You're talking about a cultural shift in many ways of focusing more on being healthy as opposed to servicing when you are not healthy, or trying to be a little bit more preventative in that way. So that's one piece, but how does this impact potentially people's ability to afford healthcare?
Well, I think, so healthcare it's such a weird industry. It's the only place where, it doesn't matter what you charge. It's the insurance does that. And we got to make sure that the insurance costs don't go up. We need to make our whole economy better for us. So the idea is the most expensive place to get care is the emergency room. And the second most expensive place is to be in a hospital. And the third one, using these examples, is probably at a nursing home or rehab center. So, but as the way healthcare is being reimbursed is you do more, you get more. So the idea is to change everybody's thinking so that we just try to, instead of focusing on volume, what they call volume, we focus on right care, right place, right time. And so if we can get people home and healthy faster, that's cheaper. I mean, you know, the cost of the highest cost system is when we go to the emergency room, right? And of course, and we need the emergency room. We absolutely need to survive. So the idea is to spread the dollars around appropriately so that we have the right structures at the right volume, but then we also are trying collectively as a community, trying to get people home and staying out of hospitals and staying out of nursing homes. Obviously, we're there if they need us. So let's get the right size, and I think it could dramatically reduce the cost of healthcare because there's not more money coming in. If people keep on competing for that same dollar and there's no more money coming in, you think about it. Well, where's the money going to come from? It's going to come from somebody else. Like it might be we don't have enough doctors here. Well, if we save some money, could we use more money to recruit more doctors? Or could we, you know, why can't we do that? And when you think about it, it's not. If we asked a population, well, what do you want more? Do you want brand shiny new building, or would you want more doctors, or you know, OBGYN or something? I bet most of the people are saying is, yeah, we need more of the doctors here. So let's try to figure out collectively. There's so much waste in healthcare, and we all know we can do it better. We just have to play together well.
Hawaii Community Foundation was an early supporter of this project. You touched on it, but how has their grant helped Hale Makua take some of the necessary steps forward, realizing this broader vision? Where has some of this support specifically gone?
Well, so the Hawaii Community Foundation, frankly, if it wasn't for them, we would not be going down this path. They supported our housing initiative. If we did not get the grant from them, I don't think we could have made the numbers work. Irrespective of all the other help, basically the county and Hawaii Community Foundation are making this workforce housing work. And I think it's a novel approach. It's not about what it's going to cost. It's about how do we fit into the income of the entry-level people. So they were key, and they have embraced this, what we call this, careplex that we are going to be building, and they want to support us and have been supporting us in raising capital to continue on in our quest to sort of build this new healthcare delivery or complex, in the middle of Kahului, where we need it the most highly populated area in Maui, right?
So it's interesting. You've stacked up some dominoes here. And it starts with trying to entice a workforce and those who are interested in entering this healthcare field to stay home on the island of Maui. And hopefully that leads to a grander improvement of care, which leads to more quality care, which leads to perhaps people being able to benefit from that care to the point where they can be home healthier for a longer period of time. And like you said, that lifts all boats, right?
Yeah, I mean, I think it's also, you know, just having a vibrant community. I mean, healthcare is not no one thing does healthcare. I mean, it's the whole community does it. I mean, we all know. I mean, it's just great to be around family and everything. And if we can build that again around the building blocks of society, I think we'll all be better off. And you know, I mean, there's a lot to it. So yeah, it's exciting. It's exciting. You know, I think it's just been fortunate. I think the people of Maui have been. You know, this is their brainchild when you think about it. It's just nobody really wanted to take it on. And, you know, it's sort of with this Maui Economic Recovery Commission, you know, some of our partners, Hawaii Community Foundation, they kept on cheering us on to say, yeah, okay, let's figure out how we can do this thing.
There are many of us in the community. I think almost everybody at some point has to face the decisions around caring for our kupuna, our loved ones as they age. And so there are going to be a lot of people who will have a lot of questions here. Where can they go to learn more? How can perhaps people show support for this project? Because there are going to be some obstacles, as there already have been, going forward.
Yeah, for sure. There's definitely going to be a lot as we move forward on this thing. You know, we are trying to be very respectful of all the county and state processes to move this forward. So there'll be a lot of time to comment. We are going to do a lot of focus groups and outreach to the community as we have over the last several years, which I want to thank the community. They're the ones that actually came up with these ideas. We did a health impact assessment. We did surveys. And this thing is being pushed by the community. You know, we're just sort of the shepherd of it. You can always go to our website, halemakua.org. There's an ability to comment, but we're going to be out in the public. We don't want this to be, a controversial project. We want the community to be driving this project. We believe it's for the right reasons, obviously. Yeah, they can. We'll just be reaching out. We want any input, good, bad, or indifferent. We're trying to be respectful of the whole community.
Where can they reach out? Is there a place where they can say?
Halemakua.org.
Got it. Okay.
Halemakua.org.
All right. As has been the case with most of these interviews, I've wanted to give the subjects a chance to just have the floor. If there's anything you wanted to add, anything you feel like we have not touched upon thoroughly enough, or just a general message that you want to get out there.
I really want to say that I moved to Maui, about 35, 40 years ago. It has been such a wonderful place to me. And I really think that this whole project is really rooted in the community and its desire to take care of itself and its kupuna. And, I just really appreciate all the lessons I've learned over the years from them. And, anything I can do to help with this, I think I feel I owe a debt to the whole community of Maui and the state of Hawaii.
Well, Wes, we appreciate you making the time to be here. Mahalo for being on Ka Pewa, and best of luck here with the project moving forward.
Thanks, Kanoa.